This session will cover living kidney donation at our center. We will be reviewing how living donors are referred and evaluated at the Washington University and Barnes-Jewish Transplant Center in St. Louis, Missouri. We will also cover required follow-up. We will discuss the referral and evaluation process, criteria for living donation, and also provide some case study examples. All candidates who are being evaluated to be a living kidney donor at the Washington University and Barnes-Jewish Transplant Center will have candidacy determined based on a standard set of selection criteria.
There are a couple of options for living donors to refer themselves for evaluation. Donor candidates can call our office or submit an online referral form. Our office phone number is 314-362-5365, option 4. Or our online referral form is available at barnesjewish.org/livingdonor.
When we see interest from an individual, we call the potential donor and ask a few screening questions to help determine if they may qualify as a living donor. A referral packet is mailed once screening is successfully completed. The referral packet has a health history questionnaire, release of information forms, and a dietary history form. Once the completed forms are returned to our office, the living donor transplant coordinator calls the patient to review the evaluation process. An evaluation is scheduled after the independent living donor advocate consults with the donor. This person on our team works to ensure that the patient's best interest is always at the forefront. The evaluation day is selected during a second conversation with the living donor coordinator. There are a few absolute contraindications for kidney donation. These include BMIs greater than 35, a history of a gastric bypass or gastric sleeve, uncontrolled hypertension, a history of stroke, diabetes, or multiple kidney stones, or a history of cancer other than skin cancer. Unfortunately, if a potential living donor has any of these, they do not qualify to become a living kidney donor.
A full evaluation includes lab testing, diagnostic testing including EKG, chest X-ray, CAT scan of abdomen and pelvis, and urine studies. Additional consults that are part of the evaluation include social worker, the donor advocate, and a donor nephrologist. Some of the initial screening can be completed where the donor lives, if they are not local residents. In order for someone to be a living kidney donor, they must be very healthy. Our team assesses risk to the donor's health both in short-term and long-term. Our team works very hard to ensure minimal risk to the donor as a result of kidney donation.
Some donors want to donate a kidney to someone they know, but they may not be a compatible match. If this happens, there are still a number of options for donation, including internal paired kidney donation. The incompatible donor and recipient are placed into an exchange program within our center that includes other recipients and donors who do not match. Recipients and donors in this larger group are then matched into compatible pairs that allow for successful transplants. National paired exchange. The incompatible donor and recipient pair are placed into a national exchange program that looks for matched pairs, pairing a compatible donor and recipient from anywhere in the United States. National exchange programs are important for recipients who are hard to match because they provide additional opportunities for matches through a national pool of donors. Blood type incompatible transplant. This innovative option may allow you to donate your kidney to the person you choose, even if your blood types are not compatible. There are specific criteria that must be met to allow a recipient to undergo this kind of transplant, but nothing changes for the living donor. Living donor transplant offers some advantages over deceased donor transplant. Decreases the amount of time the recipient must wait for transplant surgery. Decreases the amount of time the recipient will be hospitalized after transplant surgery. Decreases the recipient's risk of potential problems after transplant surgery. Increases the number of years the recipient will benefit from transplant surgery.
Let's review some case examples to illustrate what we have talked about up to this point. Case 1. John is a 35-year-old male who wants to donate a kidney to his mother, who is age 68 years old. John completes his initial testing at a hospital near his home in Tennessee. The results are reviewed, and he is approved to come to St. Louis for additional evaluation. John is scheduled for a one-day evaluation at Barnes-Jewish Hospital. On his evaluation day, he completes a CT scan, meets with the donor advocate and social worker, and has an appointment with the donor nephrologist who reviews all of his results with him. John is signed off to be a donor and picks a date for surgery. He and his mother come to the hospital for pre-op testing and are admitted 2 weeks later for their surgeries. John goes home on post-operative day 2 and returns to his work as an accountant 5 weeks after his surgery.
Case 2. Cindy is a 42-year-old female who wants to donate to her sister Betty, age 45. Cindy's health history reveals that she is a pre-diabetic and taking metformin prescribed by her primary care physician. Because Cindy is a pre-diabetic, she is not allowed to process with donor testing at this time. Her brother Bill moves forward with testing to be Betty's living kidney donor.
Case 3. Jeff is a 70-year-old male wanting to donate to his granddaughter, Emily. In addition to the standard evaluation testing, Jeff is required to complete a stress test to make sure his heart is healthy enough to undergo donation surgery. All of his evaluation testing is reviewed, and he is able to move forward with donating to Emily.
There are a variety of individual circumstances for our donors. This is a brief overview of our Living Donor program at the Washington University and Barnes-Jewish Transplant Center. We hope that you have enjoyed this presentation about referral and evaluation for living donors. We are always here to answer any questions you may have on behalf of your patients. There are 3 other presentations available: the kidney transplant evaluation process, the role of multidisciplinary team members, and the waiting list and being called in for kidney transplant. We hope to see you again soon.